Okay, this skill is assisting patient with use of bedpan. There's two different kinds of bedpans. You have a fracture pan, which is a lot shorter, easier for patients that can't raise their hips. And then you have the traditional bedpan. You can offer your patient a choice between which bedpan they would rather use, or you can just go with this one if it's not a patient with a hip fracture. Your bedpans are going to be stored in a designated dirty area because these bedpans have been used by this patient. And so once you touch the bedpan, you're not allowed to touch anything else. So keep that in mind as we go through the skill. Hi, Miss Manny. How are you?
Good, how are you?
I'm Brenda. I'm going to be your CNA, and I'm going to help you with the bedpan, okay?
Okay.
All right. I'm going to wash my hands, provide privacy. I've already gotten some supplies here. I need a towel, a pad, 2 pair of gloves, and toilet paper and wipes. And I haven't gotten my bedpan yet because that's in the designated dirty area, and I'm going to keep it there until I'm ready for it. When you get patients on and off the bedpan, you need to make sure that the bed is completely flat and your opposing side rail's up. I'm going to roll my pad halfway and undress her a little bit here. Make sure to not overexpose your patient. Okay, let me go get your bedpan and I'll be right back. Go ahead and put on my gloves. You have this towel that you can use for extra privacy if you need it. When you grab your bedpan, if you put it under this way, that flat piece needs to go against the patient's tailbone. All right, I'm going to have you roll over to your left. Thank you. And you can put your bedpan, again, this part right on the tailbone. You have to kind of push it under just a little bit and come back over toward me. How's that?
Yeah, it's great.
Not very comfortable. Okay. I'm going to go ahead and take off my gloves right now because, again, I'm contaminated from having touched the bedpan. Okay, let me cover you up. I'm going to sit you up to pee, okay? Which is a more natural position for people to urinate. How's that, okay? All right, look, here's your call light. I want you to call me when you get finished. And I have some toilet paper and wipes here. You can use the toilet paper to wipe yourself and some wipes to clean your hands. And if you can't get yourself completely clean, I'll help you out when I get back, okay?
Okay.
And there's a trash can right there.
Okay.
All right, so call me when you get done. Make sure you wash your hands when you leave the room. And now I'm going to come back in the room and wash my hands again. She's all finished. You all done? All right, I'm gonna get you off the bedpan now. I'm gonna lay you flat first. Okay. Go ahead and make sure she's not overexposed. Her gown's covering her. Were you able to wipe okay?
Yes.
Okay. Okay, so I'm going to go ahead and turn you over roll over to your left again. Hold the bedpan as the patient's rolling off. Put your bedpan that has the urine in it, set it on top of your toilet, on top of your trash can. You can use the wipes to wipe your patient if needed, if she wasn't able to do it by herself. And you can also use the towel to dry her if needed. Okay, roll the pad back in and come on over toward me. Okay, and you're covered. I'll be right back, okay? I'm going to get rid of this and come back clean.
Okay.
This goes straight into the hamper. Make sure that you don't throw it on the floor, put it on the table, right in the hamper. When you discard your urine, it only goes in the toilet, never the sink. We do need to rinse it out. Turn your water on, put a little bit of water in there, rinse it, and then make sure that you dry it. Put your bedpan back into the designated dirty area. Take the wipes and the toilet paper and put that back in the patient's designated dirty area. Gloves off, wash hands. And now I can touch my patient again. All right. There you go. Here's your call light. Are you comfortable?
Yes.
All right. Call me if you need anything, okay?
Okay, thank you.
All right. Still complete.